I'm Sarah Lee-Davisson, and I'm a general surgeon down in Tucson, Arizona. I'm doing emergency general surgery now at Tucson Medical Center. I remember never really questioning that I was going to be in some sort of helping profession. My mom was a nurse and my dad was a pastor, and so it was just kind of in our family that we actually all my siblings and I, end up in helping professions. The doctor route, I still sometimes wonder exactly how I got on that. I was always a good student, and then in college I was part of an emergency support team where we did 24/7 call for any emergencies on campus, which now looking back and how many nights I've been on call in my actual life, why I started that earlier than I had to still baffles me a little bit. But I did go to medical school, and I remember panicking a little bit during my third year because I had always thought I wanted to be a pediatrician or geriatrician. I liked old people, I liked young people, I was good with those people at our church. And then I was doing all my third year rotations and I did not like anything. And I knew I was just too far in debt to not do something at this point. And one of my last third year rotations was surgery because I thought there was no way I was ever going to be a surgeon. But the very first shift, I knew that that was the one. It was great. I had a fellow at the time, and I was down at University of Southern California. I was busy, trauma center, community service type vibe there. And they were letting me do things that I was like, wow, you know, just the confidence they had in helping me make that first incision and the expediency of everything, the fact that we could make a difference so visibly and so quickly. I loved all of it, so I knew I was hooked on surgery at that point. Advocacy has been sort of a unexpected newcomer in my life in the last few years. The thing I'm most excited about right now is, and I'm going to shamelessly plug this, is that the Arizona chapter of the American College of Surgeons, for which I'm the advocacy chairperson right now, we are planning a advocacy day at the Capitol in March. And it's going to be around Stop the Bleed, which is a national initiative to get people more comfortable that if they see somebody bleeding, how to apply pressure, how to pack wounds, and how to apply tourniquets. So it's pretty simple stuff, but very life-saving for more people to know. When there's an accident, you don't have time to figure that out or Google it or whatever. So we really want to get that training out, and there's going to be a bill going through the state legislation this year regarding that. And so we're planning our day around that. And so on March 16th, we're going to have a bunch of surgeons and hopefully some other folks too, teaching the legislators how to stop the bleed as well as why it's important. And I also hope to just have a lot of doctors there that can get to meet the legislators and be an ongoing resource for them. How I got involved in advocacy was through a leadership course that I took during the pandemic. And that leadership course, I went into it thinking it was going to be a typical leadership course, how to dress the part, how to speak the part, shake hands, and do kind of the typical things we think of as leadership. But what they were really focused on is that, yes, that we all have our day-to-day challenges that we need to solve, our problem at our practice or in our hospital or in our community. But when you really look at healthcare and being a leader in healthcare, they're bigger issues, right? There's laws passed all the time at the state and at the national level that affect how we take care of our patients. And so to step into that advocacy arena and help those legislators to make good rules that make sense, that help us better healthcare in the future, it's actually really important. And there's a million different ways you can do that, from joining your organized medicine organizations to donating money to causes that speak to you, or to actually getting boots on the ground, talking to the legislators, emailing and texting and calling them. And so actually learning how to do all that can be a little overwhelming. It definitely was not a straight journey for me. I had to kind of figure all that out on my own, but it's been incredibly rewarding. My friend, who also happens to be a coach, she has a couple doozies that I always love to quote, but one of them that really profoundly impacted me was when she said, "Not everybody has to be right about you." And it was in relation to what a lot of us surgeons talk about with her a lot, which is that, you know, we put so much of ourselves into our jobs. And I think this is probably not just physicians, but that's the experience I have. We put so much into our jobs, and when somebody isn't happy with the care we're providing, or a nurse doesn't like the way we communicated with them, or it could be anything, right? A board complaint, anything. It does feel strongly like a betrayal, like it feels like a personal affront. And so when she said, not everybody has to be right about you, it's kind of her way of saying, just be yourself. As long as you're being authentically good at what you do, as long as you really did try the best for that patient, or you really did try to work as collaboratively with the nurse or anybody that you're trying to, there's going to be some people that are just wrong about you, and you don't have to spend all your energy to convince them otherwise. Some people, it's okay if they have the wrong impression of you. Others, you may want to try to repair that, right? But it's up to you whether you decide to do that or not. And I just find that to be a really liberating concept. Not everybody has to be right about me. Most of my patients, when they know to ask about, do you listen to music in the OR, because they've heard about that from a lot of people, they're usually very surprised to hear that I like hip hop and rap, especially 90s rap in the OR. That's my go-to. And they always look at me like, really? Okay. For some reason that definitely strikes them as something that doesn't quite make sense. I think the most common misperception about surgeons is that we're all not very nice. And so I think that the reality of it, sure, of course there's some that are not very nice, because there's some of everybody that isn't very nice. But we are very direct. Our training is harsh in most cases, especially those of us that are of a certain generation. I'm 18 years into my career, so I am of that generation, where our training was not nice. It was tough, and it makes us very direct, and we can come off as not very nice sometimes. So the reason I bring this one up recently, I'm married for, I think we'll be at our 5-year anniversary. So this is my husband when he found out what I did, and he works in an adjacent field. He works in medical technology stuff. And when he found out I was a surgeon, he was like, ew. And I think he did have second thoughts about asking me out in person, but he did decide to do that, and the rest is history, because most of the times we're just normal people too, and we can be nice a lot of the time, and then sometimes we're not so nice, just like most people. But I do think that's one misperception that definitely gets played up a lot. Even on pretty realistic medical shows, the surgeons are usually the ones that are a little mean and like tough and like not very human. So I think that's one misperception of our field. So when we talk about humanism in medicine, I think a really important part of that is making sure that we're treating our patients not just as the disease or another patient. They are a human being with each of their unique needs, and that's important. But the focus I've taken on with humanism in medicine in the last few years of my career, as I've had a little more clarity and already being pretty good at that in the early part of my career, would be humanism towards each other, giving each other the benefit of the doubt, our other specialists, our colleagues and our partners. I feel like we can get fairly judgmental on other physicians or other clinicians pretty quickly because the system is broken, and it's easier for me to just be unhappy with one particular nurse's decision or one particular partner's decision than to be mad at the entire system, because it makes us feel a little powerless with how much is broken. But I think that when I think of humanism in medicine, it's looking at my colleagues as humans. And I've made much more effort recently to reach out to people when I know that they had a bad outcome, to let them know that they're not alone. And this doesn't make them a bad doctor, it doesn't make them a bad nurse. These things happen, we're all human, and knowing that we're not alone will help them get through that, learn from it, and progress in a more positive direction. So I think that's something we can all do better at. I also find that coaching has been incredible for helping me with that mindset, for having more of an attitude of trying to find the positive in situations and being more supportive of myself as well as others.